do genuinely believe that AI has a huge role to play in the future when it comes to really making the medical system work again. I don't have full faith in the AI just yet. The more and more sophisticated AI gets, it's going to be harder to tell which photos are actual before and afters and which photos were just made by a computer system. And that's where I think ultimately with AI, we have to be really careful in the field of cosmetic surgery. I actually prefer to do manual Photoshop of images, mostly for my own surgical planning because it kind of tells me where the nose should land. I don't usually share it with the patient because I don't want it to psychologically bias you and make you feel potentially uncomfortable about parts of your face that you had never thought about changing before. All right, everyone, welcome back. Today's topic is going to be about something that's been really popular in the news, and that is AI. And what I want to talk about specifically is how AI actually relates to the field of plastic surgery, because if you didn't know, AI is one of my biggest passions next to plastic surgery, and really trying to figure out where AI is going to be most effective in our field as time progresses. So in general, I will be very transparent. I do a lot of research on AI. I've been implementing AI in my practice for operations, for lead management, for a ton of different things, because I do genuinely believe that AI has a huge role to play in the future when it comes to really making the medical system work again. But there is one area in which I don't still feel very comfortable using AI, and that's when I'm simulating a patient's before and after photos. Why don't I like it? Well, it's ultimately because I don't have full faith in the AI just yet to actually create a result that is achievable by plastic surgery. Because one thing that you'll be able to notice if you go look back at any photos of people you know or of celebrities or political figures that are done by AI, yes, it looks almost 100% like that individual. But if you pay close attention, you'll notice if you put their picture next to the AI doctored image, there are always going to be slightly altered things about their face, such as where the corners of their mouth are by a couple millimeters, maybe the slight change in the shape of their eyes or their brow position. And that is what's going to really be the telltale sign that that image was created by AI. Now, where does that fit into the plastic surgery before and after realm? Well, ultimately, let's say you wanted to get a nose job and you come to my office and I say, let's say I want to take down the hump on your nose and lift the tip slightly and do da-da-da to your nostrils. Well, I can tell the AI that that's what I want to do, but even with the most sophisticated AI softwares we have right now available to the public, the image generation is still going to do exactly what I had told you about the public figures and the celebrities, where it changes slight things about the facial features. And why is that so important? Because the slightest change to the corners of the mouth or the shape of the eye, if we're doing a rhinoplasty, yeah, it might not seem like that big of a deal, but ultimately, let's say a rhinoplasty patient is already somebody who is going to be very critical of their very minute facial features and pay attention to the slightest irregularities that may exist. So if the nose looks a lot better, but there is a slight change to the shape of the eye, and that's not something that we're going to be working on surgically, what's going to happen is that you may not even actually notice that slight change, but what you will notice is that your after photo, once the surgery is done and you're all healed, is never going to totally match up to that AI doctored photo, because of those slight changes that the AI did to your face, whether or not you did like those changes. And that's where your subconscious is going to register those changes as flaws and therefore make you likely to be less happy with your result once the healing process has finished. So what do I prefer to do for patients? Well, I actually prefer to do manual Photoshop of images. Specifically for a rhinoplasty patient, I like to do it at the side profile, mostly for my own surgical planning, because it kind of tells me where the nose should land or where the features I'm trying to adjust should ultimately end up. But I don't usually share it with the patient because, like I said, I don't want it to psychologically bias you and make you feel potentially uncomfortable about parts of your face that you had never thought about changing before. And that's where I think ultimately with AI, we have to be really careful in the field of cosmetic surgery, not only because of before and after photos that are going to affect how a patient heals, but also by the before and after photos you may see online. Because the truth is, as much as I would like to say that every doctor is totally honest and follows the Hippocratic Oath to a T, The reality is that as doctors, we are human beings too, and the truth is that just like any kind of human being, there are going to be those of us who follow the rules, and there are going to be those of us who like to break the rules for sake of personal gain. So you need to be very skeptical, as with anything that you see on the internet, even with before and afters, because the more and more sophisticated AI gets, it's going to be harder to tell which photos are actual before and afters and which photos were just made by a computer system. So, like I said, as much as I think that AI has a huge use in medicine by decreasing the administrative load that providers are required to do, that decreases the amount of time we spend on things other than patient care, that allows doctors to be freed up more to be able to enjoy time with their patients, using things like an AI scribe or an AI software that helps to organize their clinic flow and all of that. I still think there's work to be done when it comes to actually presenting AI photos to patients, whether it's for the sake of marketing, for the sake of helping somebody understand their before and after, because at the end of the day, even those slightest changes are going to have an impact on how you see yourself. And the last thing I would want is for an AI software to suddenly make you feel uncomfortable about a facial feature of yours that you didn't even know made you uncomfortable before, because that's exactly how we get to a world where we start leading people into body dysmorphia rather than away from it. So basically, moral of the story, I think AI has a huge use in our field, and it will do great things for our field if used correctly. But when it comes to the photos, I'm still hesitant to use it. So I hope you enjoyed today's discussion. If you have any questions, comment them below. Make sure to like, share, and subscribe this episode. And tune in next week to see our topic and hear what I have to say about whatever other topic in plastic surgery I decide I want to talk about. Well, I'm Dr. Sean, a plastic surgeon in Beverly Hills, and I'll see you next time.